The following segment is being sponsored by El Paso Health. Today we have a very special guest. His name is Dr. Aldo Manspons. He's a gastroenterologist, and today we're going to be talking about functional abdominal pain. How are you doing today?
Good, thank you. Thanks for inviting me today.
No, thank you. We have a very special topic today, and the purpose is to learn about this condition, doctor. How do we find out about this condition?
So functional abdominal pain is, the key thing is making a distinction between disease and no disease. Okay. And a disease, or something worrisome, would be if a little kid, so I'm a pediatric gastroenterologist, so a little kid comes to see me, their parents, and if the child has weight loss, chronic diarrhea, bloody stools, vomiting with an effort, waking up in the middle of the night because of the pain, ulcers in the mouth, joint pain, any of those things, then I'm worried about something else.
Okay.
None of those things, then I'm not worried about a specific disease, but more the topic of functional abdominal pain, which means there's not a true disease, but it's more a connection between the brain and the intestines.
Okay.
And so oftentimes when I'm explaining, like parents will ask me, what is functional abdominal pain? I'll refer to something that used to happen to me a lot with my sister, where she would force me to watch scary movies, and I would get belly pain and I would vomit.
Wow.
I don't know if that ever happened to you, but it happened to me a lot.
Yes, when somebody scares me. Yes.
Yeah, and
so everything's related to.
Everything's related, and so there's a reason why something's called the gut feeling or gut reactions, because there's definitely a connection there.
You actually feel something here.
Yes.
When you get scared, when you get anxiety, when something bad happens, you actually get that feeling here.
That's right. So I remember the Juan Luis Guerra song, Se me sube la bilirrubina. Right?
Yes.
Probably something similar.
Wow. So this condition, doctor, we shouldn't worry if our child is diagnosed with this condition, right? Is this a condition?
Yeah, well, it's a process to get to the diagnosis. I think the parents should start off with, or the caregivers start off with their pediatrician or their caregiver, their provider.
Okay.
And then the provider then makes decisions about referrals or not referrals. So referral would be pediatric gastroenterologist or not. And then once the kid comes to me and we kind of go down the path, and it's important to make a really firm diagnosis, because if not, then we end up doing a bunch of things that are totally unnecessary. So labs, CT scans, potential surgeries, endoscopies, so putting the kid to sleep and checking with endoscopy from above and from below without maybe necessarily having to do so. And so if we get a diagnosis that's pretty clear, then everybody needs to buy in so that we form a team. Right? So between the parents, the kid, myself, and counseling becomes really, really important. And so finding counselors that do cognitive behavioral therapy. Okay. Hypnotherapy is also part of this, but cognitive behavioral therapy is ways of dealing with stress and anxiety in a way that doesn't require medications.
Yes, because we as parents, just imagine, okay, I take my son to the hospital. I have my son there in the hospital. I'm going to be very worried to the point where I'm going to start having anxiety as well. We sometimes tend to be very negative. Right. We think there's something wrong with my child. What is going on with my child? This is very constant. Is this something that happens often within children, doctor?
All the time. So
they want to go to school, for example?
They don't go to school. So 10 to 15% of kids have functional abdominal pain. So we think El Paso has 250,000 kids, 10% of them, so about 25,000 kids probably have about functional abdominal pain. And so I think it becomes important to kind of make an assessment whether does this happen only during school time? Does this happen during the summer? Did it happen on the weekends? And then kind of putting everything together. Right? Is it during test time? There's a lot of kids who are straight A students who don't like to mess up and everything is perfect. And high levels of stress, and they manifested in their belly a lot of times.
Oh, wow. So you were mentioning once they come to you or the doctor, there are some kind of accommodations that they get in school, for example?
I think it's really important to work with the teachers, with the pediatricians, and myself, and even the dietitians. So what I often do is I'll write letters for these kids who have this issue, so that they have bathroom privileges. So they go regularly to the bathroom when they need to.
Okay.
I don't think it's a healthy thing to hold. If you have to go poop, you got to go poop. You know, what are you going to
Exactly.
do? And then make an assessment about the diet. So foods that commonly cause a lot of pain because they cause gas, dairy products, juice, candies, gum, all these things can cause a lot of belly pain. There's definitely a relationship between the bacteria that we have in our intestines and the food we eat. And so, you know, there's truth to like you are what you eat kind of thing. And so the types of food that we eat will change the types of bacteria that we have. And so if you eat like super healthy vegetables, fruits, and not a lot of protein or not a lot of meats, you're gonna have certain types of bacteria. And if you eat more processed foods, lots of sugary things, different types of bacteria.
How interesting. Okay. So we as parents, doctor, not all children have this condition, of course. What can we do to ease that pain? When they get that pain, and we already know, you already told us it's nothing serious, right? What can we do as parents to ease that discomfort?
If a diagnosis is firm, all the warning, the scary things are ruled out, then it's important to buy into the diagnosis, to say this is the right thing, and avoid the temptation of going to the ER, avoid the temptation, as long as it's appropriate, right? I'm not trying to say don't ever go to the ER if it's not appropriate. And then looking at the diet, so avoiding the foods that I mentioned about gas-producing foods, and then working with counseling. I think counseling becomes really, really important, and it becomes a way of dealing with stress. Stress doesn't go away, right? As we get older, it just becomes more intense.
Yes.
But dealing with stress becomes, having the tools to deal with stress becomes very important, both for the kid and the parents. And so I think it's important for parents to when they see their child in pain, taking a step back and really making an assessment about what's going on and say, is this the same kind of deal that's been going on, or is this something new? And if it's the same kind of pain, then saying, look, let's go back to our behavioral techniques that we learned, either breathing exercises or putting the pain in the elevator as an example for cognitive behavioral therapy, putting the pain in the elevator, sending the elevator down so that the pain goes away. Right, these are kind of techniques I think that are learned with the counselors.
How interesting. So family therapy would definitely work.
I think it's a new thing. I think as a community, I think El Paso, we're kind of buying into more kind of mental health, mental wellness. I think it's really important for us as a community to continue with that and grow in this mental awareness track.
Awesome. So parents, if you don't see all these red flags that he was mentioning, such as your child is throwing up, he has diarrhea, he has all this bad symptoms, don't worry.
So start with your pediatrician, start with your provider, and then kind of work from there and kind of have them quarterback the situation a little bit, and then they'll make the decision whether to refer or not to refer.
Okay. Awesome. Well, thank you, doctor. Thank you for educating us about
this
subject.
My pleasure. Thanks for inviting me. Thank you very much for having me talk about functional abdominal pain.
Yes, and hopefully we'll be here soon and talk about other topics. Thank you, and we'll see you on our next segment.